Hi there. I'm Dr. Danielle Andrade. I am a neurologist specialized in adults with genetic forms of epilepsy. One of the things that I also do, I am the director of a transition program where we move patients from pediatric to adult care. And I am also the chair of a transition task force set up by the International League Against Epilepsy. The reason why I'm doing this video is to invite you to participate in a research by the ILAE to understand how the transition process is for patients with rare epilepsies. So I'll just share with you a few slides to give you a little bit of background, and then I'll tell you about the research a little bit more. So let me start with this. So we have the International League Against Epilepsy has struck this transition in care from childhood to adult task force. I am the chair, and we have several other uh, neurologists involved. Most of them are pediatric neurologists, and they are in all continents. So, one of the things that we did actually even before this task force was another task force just here in the province of Ontario, and we published these results in a journal called Epilepsy. And as with this kind of things, we develop a toolkit that helps patients moving from pediatric to adult care, but this was mainly directed to the healthcare practitioners, the nurses, the doctors, the social workers, with several steps of how to do things. And of course, the conclusion is that a multidisciplinary clinic is the ideal for a transition program. But what is very important is that the lack of a multidisciplinary program should not be a hindrance for an appropriate transfer of care to adult services. And one of the things we think we can do is to empower patients and families to help them through the transition process, even in places where there is no formal transition programs. And that's what we want to do here. One of the challenges we see in patients with rare epilepsies is the fact that most adult neurologists are not very familiar with their case. So this is a picture that we have from this paper we published in Epilepsy, showing that in the past, the adults that would come from a pediatric center, they usually had a diagnosis that was familiar to the neurologist, like temporal lobe epilepsy, genetic generalized epilepsy, things that you're seeing here. And those that had what I call the $1 million workup in childhood, but didn't have a diagnosis, they would come to the adult system with the label of symptomatic epilepsy. Now, with next generation sequencing and all these new technologies, these patients, they have different diagnoses, and we can tell. So we have patients with Dravet syndrome, we have patients with PCDH19, CHAD2, STXBP1, SYNGAP1. There's an infinity of different genes causing severe epilepsy, usually associated with intellectual disability, sometimes autism as well. And now these patients are coming to the adult neurologist, and the adult neurologist many times never heard of these conditions. So we think we could try to help the patients and families. But to do that, we want to understand a little bit more about their experience. So in terms of what our task force is doing, we have a questionnaire that we are sending to physicians to understand their experience, and a questionnaire that we want to send to patients, you in this case, patients and families. And we are trying to understand what happens before transition. So patients that are 12 years old and above are welcome to answer this questionnaire, or families of patients 12 and above. So both those that should be prepared to transition, so 12 years and above, you should start being prepared for the transition. And those that went through this phase already, they might be 18, 19, 20, 30 years old. We want to hear what was your experience going through this process, moving from pediatric to the adult system. So the way we want to hear from you is through a questionnaire, like I said. And at the end, we want to create a toolkit based on your answers. The team of this task force wants to develop a toolkit that will help facilitate this process of moving from the pediatric to the adult care. So I hope you can participate in this research. It has been approved by our research ethics board. And if you agree, of course, we would ask you just to consent to this. All the information will be anonymized. So we get we don't get your full name or anything that could identify you as a patient. So all this will be anonymized, and we will work with the data that we collect to develop this toolkit. Okay, we're going to leave here our email, and if you have any questions before deciding whether or not you want to take part of the research, or if you decided you want to take part and you have any questions during the questionnaire that you're answering, please just contact us and we'll be very happy to help. Okay, thank you very much for your participation. Bye.